Today marks 1 year since the first American received a COVID-19 vaccine after the vaccines were authorized. Since then, more than 200 million Americans have been fully vaccinated, with more than 54 million Americans getting a booster. Despite the success of the nation's immunization efforts, the death toll has continued to climb. More than 50 million Americans have tested positive for the virus since the start of the pandemic last year. That has resulted in more than 798,000 COVID-related deaths nationwide. An estimated 1,200 Americans are losing their lives every day from infection. At that rate, the U.S. will hit 800,000 coronavirus-related deaths by the end of the day. In preparation for this milestone, a bipartisan group of congressional lawmakers will be gathering on the steps of Capitol Hill this evening for a moment of silence. Together, they intend to honor the 800,000 lives lost over the past year and a half. However, there is some hopeful news on the horizon in the global fight against the pandemic. Pfizer has officially submitted its COVID antiviral pill to the FDA for emergency use authorization. The drug company says its pill is highly effective at reducing the risk of hospitalization in high-risk patients. If approved, it can be prescribed as soon as a person learns of possible exposure. Earlier, CDC Director Dr. Rochelle Walensky spoke to my colleagues on CBS Mornings about the significance of this news.
Get your vaccine, get your booster, take all of those prevention measures. But if you were to get sick with COVID, then, we now have a new tool in our armamentarium, and that's terrific. So should this tool move through the FDA through authorization, the really important thing here is that you have to test quickly.
Joining us now for more on this is Dr. Louise Aronson. She is a professor of medicine at University of California, San Francisco's Division of Geriatrics, and the author of the New York Times bestseller, Elderhood. Dr. Aronson, great to see you. Thank you for joining us. So roughly 3/4 of COVID-related deaths have been among people 65 and older. What do we need to be doing better as a society to protect our nation's senior citizens and other vulnerable members of the population?
Oof, well, I wish we could turn back time. That would help a lot, because if you look at the measures that we take to prevent, to keep people safe, which starts with masks and other PPE and testing, older people were actually only prioritized for vaccination. Not one other aspect of the interventions that we know save lives were given to the people we knew to be at highest risk before the pandemic hit the shores of the United States.
Right. So now we can't make up for those mistakes, right? Here we are.
Right.
And roughly 1,200 Americans are dying every day still from COVID-19. Last year we didn't have COVID-19 vaccines, and the death toll rapidly climbed during the colder winter months. This year we do have the vaccines. Do you expect to see the same sort of rate of COVID this year, despite millions of people being fully vaccinated?
No, I don't think so. What I would say, I would echo what we just heard Dr. Walensky say. We do know that not as many older people have received their booster as received the first 2 shots. And we also know that the body's ability to combat COVID goes down 6 months after the first shots, and that booster it makes all the difference. So I think this winter we will see definitely more cases. We're actually already seeing an uptick in response to Thanksgiving gatherings. This will be mostly among the unvaccinated, but there will be breakthrough infections. Right now, we're still seeing mostly Delta. Breakthrough infections much more common in older people and people with chronic disease or immune deficiencies. So everybody should continue to be safe. Have everybody test before you get together. Do everything outdoors if you're in a part of the country where that's possible. But most importantly, get vaccinated, get the booster. It really saves lives. I should just add that we're seeing across the country people who are unvaccinated or inadequately vaccinated showing up at emergency rooms and hospitals, and they are, without exception, saying 2 things. I had no idea it would be this bad, and please, can I have the vaccine now? And what we have to say is, no, now we need to try and save your life. So if you haven't had a vaccine, please get one.
I want to ask you, though, about the efficiency of this new vaccine at tackling the new variant, right? Or the boosters of tackling the variant, because a new study out of South Africa suggests 2 doses of the Pfizer vaccine are significantly less effective at preventing Omicron infections, right? So preliminary research suggests the vaccine is 70% effective at preventing hospitalizations. However, just 30% effective in protecting against Omicron. Again, this is just preliminary research. There's still a lot that doctors are trying to figure out about Omicron. But what do you make of these numbers, and how should Americans take this new information?
Well, it's sort of mixed information. So as you said, in protecting from getting Omicron, the rates are not good. They're at about 30%. Better than nothing, but not, the 80% protection we see against other variants. The good news was, at least for this population in South Africa, that about 70% of people were protected from severe disease and hospitalization. Now, the huge caveat here is that COVID is so widespread in South Africa, these people may have had the equivalent of 3 vaccines because they had 2 Pfizer vaccines. And if they also had had COVID, that's sort of like having 3. So again, we need to emphasize in this country that that data may not apply unless people get a booster. And even then, it's not ideal.
Right. And, Pfizer is releasing new data from the clinical trial of its oral COVID-19 antiviral drug. That's something we were talking about earlier. The drug company says that the treatment is 89% effective at preventing high-risk people from being hospitalized. We can include seniors in that group, right? And no,
definitely.
So for you, as someone who works closely with a high-risk group, the elderly, would the release of a pill like this, be something that you would celebrate or cause any concern for you? Because the thing is, you've got to catch the infection pretty quickly for this pill to be effective, right? Do you think it's a game changer or not?
I think it'll be partly a game changer, but I guess the analogy that I like to think about is, it's better to use contraception than to get pregnant. And then, yes, now we have pills for abortion, but it would just better not to be pregnant in the first place. So again, vaccination to not get COVID in the first place is really important. But because we do see breakthrough infections more commonly in older people and older people with chronic disease, and I actually would like to take just a second to define that, because when we say senior or elderly, people tend to think of people over 70, over 80, over 90. And what we see with COVID is that the risk begins to increase in middle age at age 45, and it gets much worse at age 60. So we are talking about a colossal segment of the American population.
Right, and these are people, and to your point, these are people who are not, in nursing homes. These are people out and about working, active members of society.
4% of older people in nursing homes. The overwhelming majority are in the community, leading our government, leading my medical center. They are among us, they are us. And so when people other the elderly and say, well, they're all in nursing homes, that's completely inaccurate. So we need to be saving all lives, because all human lives matter. And this should absolutely help to keep people healthy if they do get infected.
Are you all worried that it might prevent some seniors from getting their booster shot or, getting further vaccinated because they think of this pill as a fallback?
Yes, and we've seen that with other diseases. On the other hand, it's still better to have a treatment than not to have a treatment. What I would say is that I haven't seen data in older people in terms of side effects, and risks of side effects go up from all medications. The other thing is we don't yet know if this will protect people from long COVID, and we know that people have gotten long COVID or chronic illness as a result of very mild COVID infections. So just emphasizing again, better not to get it, better to get vaccines and booster vaccines.
Great advice. Dr. Louise Aronson, thank you so much for joining us. We appreciate all your expertise.
Thank you.